We have Yasmeen Akhtar present here. She is working as Director Operation with Nayi Zindagi, which is a non-for-profit organization working on people who use drugs, and she's working since 1989 in Pakistan. The organization is currently executing the nationwide harm reduction program with the support of Global Fund. It's actively working for people who inject drugs. Another very important topic, and she is going to speak on harm reduction services in Pakistan. Thank you very much, Yasmeen.
Assalamu alaikum and good evening. Thank you, Dr. Asad, and thank you, PSH, for inviting me on this event. It's a great topic to discuss, and harm reduction is especially very much relevant to the issue. So briefly, Nayi Zindagi is already introduced briefly by Dr. Asad, but I'll touch on the objectives. Nayi Zindagi is a non-for-profit organization working since 1989 in Pakistan with people who use drugs, and then providing them drug treatment, and then HIV prevention, and referral linkages to HIV care support treatment. So this is a right-based services programs for persons affected by drug use, HIV and AIDS. And we aim to work with people and communities affected by drug use, HIV and AIDS, and empower them to improve their knowledge, health, socio-economic well-being. So the approaches employed by Nayi Zindagi is the evidence and need-based programming, real-time monitoring and analysis, and operational research and rapid situation assessment. Before we start services in any of the district, we have a rapid assessment exercise there to determine the hot spots where people use to inject the drugs and plan our field movements accordingly. So we have a huge coverage program in Pakistan covering almost 58 districts where injecting drug use is most prevalent, to cover the 8,000 people on daily basis. So Nayi Zindagi's outreach field teams meet on daily basis about 8,000 people and provide them with clean syringes and collect back the used needle and syringes. And also mobile van units, HIV testing is also provided on the spots. And then we also have a parallel program for their spouses. People who inject use, their spouses are at high risk of infection transmission. So we have female staff who used to visit the homes and provide HIV testing and counseling, and then referral to HIV care and support treatments. Another component of Nayi Zindagi program is ART adherence unit. That is a 3 to 6 weeks residential program. We have 4 units, one is in Sindh and 2 Punjab and 1 capital. This is a residential program, and it's mainly designed for treatment preparedness regarding antiretroviral treatment, since because of the chaotic drug use and difficulty to travel to the ART centers on regularly basis, one-time referral is made for issuance of ART, and then their ART treatment is started at the residential centers. So people who inject drugs used to attend this program with their consent, with their voluntary consent. Then Nayi Zindagi has its own management information system which has active and live data, and each and every contact with the persons who inject drugs is recorded. We have point of care viral load testing and CD4 testing as well. And then a follow-up mechanism to monitor the adherence. This is the geographical presence. In all the 4 provinces, we have 44 COPC sites, but coverage is in 58 districts. So few of the districts are being managed through one COPC site manages 2 districts in some cases. Few of the points I already mentioned. Almost 230 outreach workers make 8,000 contacts daily with PWIDs with complete package of prevention services, including syringes, swabs, condoms, and then 24,000 syringes every day to over 500 hotspots across Pakistan. And in 2021, syringe distribution per person per year was calculated as 215, as reported on our MIS system and our website as well. and in monthly basis provide 3,000 antiseptic dressings on the spots to people who inject drugs, and for HIV testing almost in a month 2,200 to 2,500 individuals are tested for HIV. And then for ART adherence, antiretroviral adherence treatment, we facilitate ARV provision to over 5,000 HIV PWIDs and their spouses every month through ART centers of public sectors, and then follow up with ART adherence. This is a brief cascade of the services. Nayi Zindagi started with the Global Fund in 2011 with the 5 COPC sites, and now it's expanded to 44 COPC sites. So far we have registered so far we have tested 77,667 people who inject drugs, and among them 37,611 people, almost 47 people, 47% of the people are HIV positive, among whom 17,897 have started ART treatment for HIV. And the other graph is showing the cascade among spouses of PWIDs. So far almost 8,000 spouses are tested, among which only 917, this is 11% of spouses are HIV positive, and 82% are linked to ART treatment. For hepatitis C, as part of baseline investigation of HIV positive PWIDs, 91% of hepatitis C co-infection was found in the group which we are targeting as a prime beneficiary. And for hepatitis B virus, only 5% prevalence rate was found among this group. Main challenges include limited availability of resources for PCR, as clients cannot afford themselves. They can't afford to travel to the facilities, and usually Nayi Zindagi staff, social mobilizers, field workers accompany them in their official vehicles to the ART centers, and often the services for hepatitis C and the ART HIV thing are on different locations. So it's very difficult in the chaotic drug use, and especially in the absence of opioid substitution therapy, to manage this travel and to link them with the treatment. So long distances to public sector ART center are barrier in linking up clients efficiently, and then absence of opioid substitution therapy essentially needed to stabilize PWID on ART and hepatitis C treatment both. So currently NZ don't have any information upon prevalence of hepatitis C virus and hepatitis B virus for non-reactive PWIDs. We only know the prevalence for those injecting drug users who are HIV positive. Those who are HIV negative, we don't have any information on that. Immediate way forward is that fortunately Nayi Zindagi has good access and HR capacity to link identified hepatitis C positive cases to diagnostic and treatment. In this regard, Nayi Zindagi has received approval to collaborate with Aga Khan hospitals for referral of PCR and treatment. HIV treatment is a lifelong treatment. With continued efforts, we are able to achieve 75% of the adherence rate among PWIDs. A better adherence rate is expected for hepatitis C treatment. NZ will be responsible to provide follow-up support for hepatitis C treatment compliance. But as Dr. Huma has mentioned about PC1 and the further expansion of hepatitis C services in Pakistan, so it would be a great opportunity, and the organization is welcome to collaborate and leverage the services with the existing programs in Pakistan for hepatitis C. But there are certain concerns because PWIDs, people who inject drugs, are actually key population. They have their own concerns, their own issues. They are only after drugs most of the times. They are not interested for their treatments, and most of the population is illiterate as well. Poverty is another issue. Stigma is another issue. So there are multiple issues, and then again there is a barrier of CNIC cards, as most of the treatment programs required CNIC cards, and as per Nayi Zindagi's MIS record, we have only 20% of the registered clients who have their CNIC cards. Rest don't have their national ID card. So that's again a challenging situation. Then geographical difference between the facilities of HIV treatment and Hep C treatment will be seen as another challenge to link them. Anyhow, these things can be worked out with the national program, and hopefully there will be some way out to combat these challenges. Thank you so much. I'll be happy to answer any questions. Thank you so much.
Thank you. Thank you very much, Yasmeen, for being here on our request. And I think the way I look at it, on behalf of Pakistan Society of Hepatology, we have to do a lot of work and cover a lot of grounds. I think my colleagues sitting here, we have to get together and find some way out in collaborating with you guys.